Hello doctors, today we are back again with part 2 of surgical instruments. First we will start with the needle and sutures. Starting with the needle, this is a needle. Needle can be round bodied, conventional cutting, reverse cutting and taper cut. And needle might have an eye that like this it doesn't have an eye. Needle might have an eye or without an eye. Advantage of this eyeless needle is it has minimal trauma, disposable needle this is, and this is comes in a pre-sterilized pack. It is faster and more efficient. Now we will see the parts of the needle. The parts of the needle, this pointed edge is known as needle point, and from this area up to this is needle length, and this is the body of the needle, and the thickness is the needle thickness. Needle is always a part of a circle. Like this needle is a 3/8 circle needle. If we draw a circle around this needle, then this is 3/8 of that needle. So from the point of that circle to the body of the needle is known as needle radius. So needle can be of 1/4, half, 3/8 or 5/8 of the circle. So this is all about the needle that you have to know. Now we will see about the suture material. First, suture material can be absorbable suture or non-absorbable suture. The absorbable suture can be natural or synthetic. The natural absorbable suture is plain or chromic catgut. Synthetic absorbable suture is vicryl, and which is also known as polygalactin, and monocryl, that is also known as polyglycapron. And non-absorbable suture, natural non-absorbable suture is silk, and synthetic non-absorbable suture is polypropylene or proline, monofilament, polyamide, that is ethylon, nylon and ethibond. Now suture can also be classified into monofilament or polyfilament. Monofilament suture have advantage because they are smooth, strong, bacterial contamination are less, and disadvantage of monofilament suture is not tied, are generally loose. An example of monofilament suture is proline, catgut, monocryl, etc. Polyfilament suture, the advantage is that not tied with polyfilament suture do not slip, and disadvantage is that bacterial contamination, the chances of bacterial contamination is very high. Example of polyfilament suture are silk, vicryl and ethibond. Now what are the criteria of an ideal suture? Ideal suture should have adequate tensile strength, have minimal tissue reaction, easy handling property, have good knotting quality. It should be non-allergic and non-carcinogenic, and should be easily available and cheap. Now we will see the description of a suture. This is a suture pack. As you can see, first 30, as you can see here written, it is 30. 30 is the thickness of the suture. Number second, here you can see a code ANYL 303328. This is the code number of the suture. Number third, here you can see it is written non-absorbable polyamide surgical suture. So this is the type of suture. Number fourth, here you can see it is written 7 cm or 2 metric. This is the length of the suture. Name of manufacturer is also written here. That is number 5th point. Apart from that, description of needle is given here. The description of needle is, it is a reverse cutting type of needle, 26 mm and 3/8 circle needle. So this is the needle, and sometimes the price of the suture, and here as a QR code is given, you can know the manufacturing date, expiry date and license number of the suture. So this is the pack of a suture. Now we will see few sutures one by one. First, this is a suture pack. How will you describe this suture first? Remember, the description of this suture is, this is a sterile pack containing 30 synthetic absorbable suture, polygalactin or vicryl coated, dyed in violet color, on an achromatic half circle rounded body needle with needle length of 20 mm and suture length of 70 cm. This is the description of the needle. So this is, as you know, this is a Vicryl or polygalactin 910 synthetic absorbable polyfilament suture. The finer polygalactin sutures are also available like 50 and 60. What are the uses of this? Like number 1 Vicryl or 10 Vicryl is used to close the costal, paramedian or McBurney's incision. 30 and 40 atraumatic needle Vicryl suture are used for biliary enteric anastomosis like cholecystectomy or hepaticojejunostomy, or it can be used for pancreaticojejunostomy. Single layer anastomosis in large gut may be done with 20 polygalactin or polyglycolic acid suture. So this is a Vicryl suture. Now this is another suture. This is natural non-absorbable suture, that is silk. The silk is derived from cocoon of silkworm larva, and this is basically a protein covered initially by an albuminous layer. The albuminous layer is removed by the processing of degumming during manufacturing of these suture. This suture is braided round a core and coated with wax to reduce the capillary action. Silk 1 or 10 is used for fixation of drain, used during cholecystectomy to ligate the cystic duct or cystic artery, used during large and small gut resection to ligate the mesenteric vessels, used to ligate the pedicles during the nephrectomy and splenectomy, and used during the truncal vagotomy to ligate the anterior and posterior vagus nerve before their division. Two ligatures are applied and the nerve is divided in between in most of the cases. Now we have two more suture. This is polydiaxone suture, that is also known as PDS. This is PDS 30 and this is PDS 20 suture. This is a synthetic delayed absorbable monofilament suture formed by polymerization of monomer, that is polydiaxone. It has longer period, that is 56 days of tensile strength. In 2 weeks, there is still 70% of tensile strength. In 4 weeks, it is 50%. In 6 weeks, it is 25% tensile strength is maintained. And in 8 weeks, it loses all the tensile strength. The 30 PDS suture is also used for bowel anastomosis, and 3040 is also used for intestinal or biliary enteric anastomosis. This is PDS suture. Now this is a polypropylene suture, also known as Prolene. This is a synthetic monofilament non-absorbable suture. Polypropylene has structural similarity to protocollagen, which is a precursor of collagen. The suture is inert and has an extremely low tissue reactivity and non-biodegradable. It has low coefficient of friction and slides through the tissue easily. The use of Prolene 1 suture is 1 and 10 are used for herniorrhaphy for repair of posterior wall of inguinal hernia. 20 is used for fixation of mesh in hernia, used for closure of midline abdomen. Prolene 1 can be used for repair of incisional hernia, and finer 40 and 50 Prolene suture are used for vascular anastomosis and for repair of nerve injury. So this is a Prolene suture. Then we have monofilament polyamide suture. This is also known as Ethilon. This is a synthetic monofilament non-absorbable suture and is a variety of nylon. This is a low coefficient of friction and easily passes through the tissue. This is used for skin closure, abdominal wall closure, for herniorrhaphy. Monofilament polyamide suture are available also in various sizes, 30, 40 up to 10 also. The finer suture are used for vascular surgeries also. So these are the few sutures that you need to know. Now we will see different type of IV cannulas. So we have 4 type of IV cannulas. You can see 4 colors here, that is green, pink, blue and yellow. So starting with, remember, the largest IV cannula, that is 14 gauge, and the larger the bore is, the smaller the gauge is. In this 4, out of this 4, the largest bore is of green cannula, and this is of 18 gauge. Pink one is 20 gauge, and then blue is 22 gauge, yellow is 24, and the smaller than yellow is purple or violet, that is 26 gauge. So first we have the orange color, that is 14 gauge. Gray is 16. Sometimes white is also available, that is 17 gauge, not so much available in India. And then the deep green is 18. pink is 20, blue is 22, yellow is 24, and violet is 26. You can also be asked about the flow rate. Remember, the deep green has a flow rate of 90 to 100 ml per minute. Pink has a flow rate of 60 to 65 ml per minute. And the blue has a flow rate of 30 to 40 ml per minute. Yellow has a flow rate of 20 to 25. And that largest one, which was orange, had a flow rate of 270 to 300 ml per minute. And the larger bore is used for mainly when the patient of trauma, like gray or deep green, is used for the trauma patient, and yellow and violet color is mainly used in the pediatric population. So this is all about the IV cannula, and this comes in a pre-sterilized pack. As you can see, this is all pre-sterilized pack. You can see you have information out here also. This is an IV cannula with integrated 3-way stop clock. This pink color is the stop clock, and it is opened in a sterile manner like this without touching. You have to open this and give it to the person who is wearing the gloves. So here I will show you the one. We have this pink colored IV cannula. We have this pink colored IV cannula here. So this is a 3-way. 3-way means first, second and third. And this is used to open and close the set. And we have a needle in here for puncturing, and we have a cannula. So this is all about the IV cannula. This is a 20 gauge IV cannula. Now we do have the Foleys balloon catheter. First we will start with one by one. The largest Foleys catheter that is generally available is blue. Then we have purple, yellow, red, orange, green, white, gray, and then black. And then we have another size that is available, that is light green also. So first we will know the few parts. So here this is a 2-way Foleys catheter. It can be 3 ways also. This part is side channel for inflating the balloon, and this part is for drainage of urine. And another port, if available, 3 ways Foleys catheter, then it is used for irrigation. This is for drainage of urine, and here you can see it is written 3 to 5 ml. What does this mean? 3 to 5 ml means 3 to 5 ml of water can be used to inflate this balloon, which is present anteriorly. Here we have a balloon that is used to inflate. The capacity of that is 3 to 5 ml. If we inflate via more amount, then the balloon will be burst. So starting with the size, everyone that the size which I have said, this is 16 French, 14 French, 12 French, 10 French and 8 French. This is in French. If someone tells you to convert this into millimeter, then the number of catheter in French, like this is of 14 French divided by 3, then whatever it comes, it is in millimeter. And this millimeter is the outer diameter of the catheter. This millimeter is the outer diameter of the catheter. So we have, starting with, I will show you a chart here. We have the blue catheter, that is 24 French. Purple catheter is 22 French. Yellow catheter is 20 French. Red is 18 French. 16 French is orange one, as you can see here. Then we have the green, that is 14 French. White is 12 French. Gray is 10 French. And the black one, this is 8 French. And the capacity, like here you can see it is water is given for 3 to 5 ml. In green one, we can see water can be given up to 30 ml. Like that in blue, which is of 24 French, water can be given up to 50 ml. Another important thing that is very important to know, that most of the book doesn't mention, what is the length of the catheter. This whole length of the catheter is of what size? From blue to white. As you can see, we have an orange color and we also have a white color. Like this, all this orange and white, this is all are of same length. As you can see, this is all of same length. That is of, this is of 38 centimeter. From blue color catheter to white color catheter. These are all 38 centimeter. But you can see this, the black one and the white one is not of same length. This is much smaller. The black one is much smaller. Means you have to remember black and the gray catheter is of same length. Black and the gray catheter is of same length. So black and gray catheter is of 25 centimeter and rest of the white to blue catheter is of 38 centimeter. So the use of this catheter is to relieve retention of urine by urethral catheterization. It can be used for suprapubic cystostomy. It is used for tube nephrostomy, urethral catheterization following urethroplasty, urethral catheterization following open prostatectomy for drainage of bladder. It can be apart from the catheter in per urethra. This can also be used for gastrostomy, jejunostomy or tube cholecystostomy. The sterilization, this is generally supplied in a pre-sterilized pack and usually sterilized by gamma irradiation. So this is all about the Foleys catheter. Now we have seen the Foleys catheter. Now we will see some of the other catheters. So this is a Malacot catheter. This is a self-retaining catheter and it is retained after it is introduced by its dilated wings end. The dilated wing end may be made straight by introducing a Malacot catheter introducer or by inserting a hemostatic forceps into the dilated end and straightening it over the introducer or hemostatic forceps. This is just like a Foleys catheter except the Malacot catheter. This is never used for urethral catheterization. It is sterilized by autoclaving. It can be used for abscess drainage or draining a area. Can be used for suprapubic cystostomy and catheter needs to be changed every 3 to 4 weeks. Generally, how to change? The local area is usually cleaned with antiseptic solution. The catheter is removed by smart pull and another catheter is introduced in the same track by stretching the tip of the catheter over a catheter introducer. This is how to change a Malacot catheter. Now we have another catheter, that is Depezer's catheter. Depezzer. Depezer's catheter is also a self-retaining catheter and it is kept in place after introduction due to its dilated bulb. Because this Malacot catheter also have a dilated bulb and this also have a dilated bulb, but these two have a difference. As you can see, bulb is thin slits are present in between them, and here the thick slits are present. So this is a self-retaining and kept in place to introduction due to dilated bulbous end. This also has a use like a Foleys catheter, but it is never used for per urethral catheterization. It is also can be used same as that of the Malacot catheter for drainage of abscess, and this is also sterilized by autoclaving. Now we have metal bougie. This is a metal bougie. The full name of this is Cluton's metal bougie. This is a solid cylindrical metallic instrument and the handle is violin shaped with a long shaft and a terminal end has a smooth curve with a blunt tip. This tip is blunt. Generally the number is written in this metal bougie, and this metal bougie is available in the set of 12. The different number can be by 6 by 10 or 8 by 12. These are the different number of the metal bougie. The use of this metal bougie is for the dilatation of the urethra in urethral stricture, dilatation of urethra prior to introduction of cystoscope. It is used to repair the ruptured urethra by railroading technique, and it is used for choledocholithotomy. It is used as a sound to ascertain the presence of bile duct stone. It may be passed through the ampulla of Vater to ascertain the patency of the ampulla. So this is a metal bougie, and this is also sterilized by autoclaving. Now we have the female metallic catheter. So this is a female metallic catheter. This is a short metallic catheter. The tip is rounded and there are multiple side holes near the tip. The use during pelvic operation to empty the bladder before operation to prevent the injury of the bladder. The bladder needs to be emptied during laparotomy from lower midline. So this metallic catheter, female metallic catheter, can be used in female. And it can be used to relieve the retention if rubber catheter cannot be passed, or if it is not available, and this is also sterilized by autoclaving. Then we have the male metallic catheter. This male metallic catheter is long metallic catheter like a dilator. The terminal part of the catheter is curved. The round tip, they have a side holes in the catheter near the tip, and there are 2 rings near the base for holding the catheter. The use is to relieve the retention when simple rubber Foleys catheter cannot be passed or not available. It is sterilized using autoclaving. How do you know the catheter has gone into the bladder if you pass this? As the catheter goes into the bladder, there is a loss of resistance, and the handle can be depressed between the thighs, and the instrument can be rotated freely on either side. No bleeding through the urethra, and urine will drain through the catheter. So this is a metallic catheter. So thank you for watching, guys. Please do like, share and subscribe. There will be part 3 of surgical instrument coming soon. Thank you guys for watching.